All right, let's just dive right into this explainer. Today we're doing something highly focused. We're going to unpack a single foundational sentence about physical therapy and activity. It's brief, sure, but it literally perfectly distills the ultimate goal of why we even endure physical rehab or daily workouts in the first place. The core statement we're deconstructing today is actually pretty simple. Exercises that will help you look and feel great. It's a really concise 9-word promise that captures the absolute ultimate goal of any effective movement routine. I mean, we see these kind of promotional statements all the time, right? But it's definitely worth unpacking exactly what this dual promise actually demands of us, especially in a clinical or rehabilitative setting where, the stakes are considerably higher than just trying to fit in your favorite pair of jeans.
So let's break this down a bit, starting with the very first half of the promise, the highly sought-after aesthetic outcome. Look, great. It's basically human nature to want a positive physical reflection, isn't it? But here's the thing. In a rehab or fitness context, this isn't just about vanity, not at all. It's the visible, tangible evidence that the work you're putting in is actually transforming your body's structure. Whether we're talking about muscle hypertrophy, losing fat, or simply, having better daily posture, those visual changes are a direct roadmap of your physiological progress.
But then, the promise pivots immediately to the internal reality, the psychological and physiological outcome of feeling great, because the goal doesn't just stop at the surface. This encompasses that targeted relief from joint pain, the incredible rush of mood-boosting endorphins, and of course, the structural stability that clinical rehabilitation actually provides. It's really about moving comfortably from the inside out. When you repair tissue damage and restore mobility, your nervous system actively downregulates pain signals, and that is literally the biological definition of starting to feel great again.
This illustrates a truly vital somatic duality. On one hand, you've got the aesthetic, and on the other, you've got the internal. True physical wellness means you really shouldn't have to choose between the two. Modern fitness culture kind of incorrectly forces people into two completely separate camps, right? Like aesthetic bodybuilding over here and functional pain relief way over there. But the absolute ultimate goal is a powerful synergy where your structural health effortlessly supports your appearance and your physical capability actively eliminates your pain. It's a total win-win. So, the absolutely crucial question becomes, what is the specific bridge between these two distinct desires? How in the world do we get from wanting to look great to actually feeling great at the exact same time? Well, we need a reliable mechanism. And spoiler alert, the recognized catalyst isn't some magic pill, a trendy wellness hack, or just wishing really, really hard. It comes right back to the very first word of our source text, exercises. That is the catalyst. It's completely active, not passive. The text deliberately places the action word right at the front of the sentence. Whether that means targeted physiotherapy for a really stubborn shoulder injury, or just a daily mobility regimen to keep your spine healthy, structured, deliberate effort is the active ingredient here. You have to actually step up and do the physical work to trigger those biological adaptations. And I want you to notice the specific phrasing right in the middle that will help you. The source doesn't claim this just does the work for you by magic. In any physical therapy or rehabilitation setting, there is a very real implied clinical partnership. The prescribed movements are basically your specialized tools. They're carefully selected by professionals to target your exact deficits. But, and this is a big but, patient compliance is literally the only way those tools will help you unlock the actual benefits. You've got to show up, execute, and meet the methodology halfway.
Bringing this whole concept together, we arrive at a truly complete equation. Targeted physical effort directly equals a compounded aesthetic and internal reward. The exercise, driven by your own dedication and guided by clinical expertise, results directly in both looking and feeling great. It's like a perfect, unbroken loop of action and dual benefit reaction. Your effort is directly funding your outcome.
As we wrap up this explainer, I want to leave you with a final thought to consider regarding the routines you choose for your own life. Are your exercises actually fulfilling this complete promise? Because if your routine only gives you one but totally sacrifices the other, like say you look good but you're constantly in joint pain, or maybe you feel fine but just aren't hitting those functional goals, well, it might be time to rethink your movement strategy. Perhaps grabbing some professional clinical guidance could get you right back on track. Thank you so much for joining me for this explainer. Keep questioning, keep moving, and I will catch you next time.